Hi, very good evening to all of you. Today we are going to discuss the case note of Miss Agnes MABEL, who is a geriatric client at the Geriatric Assessment and Rehabilitation Unit. So now you are a nurse working in a ward where Miss Agnes was admitted to. Miss Agnes MABEL is 79, married, and has husband, 3 children, who lives in the same area. Let's go ahead with the writing task. When you go with the writing task, we are going to write a referral letter to the practice nurse at Newtown Medical Center regarding Miss MABEL. Include present medical history and plan. So you are going to write a referral letter to the practice nurse. And it's at Newtown Medical Center. You have to include the present medical history and discharge plan in the letter. Remember, we need to include the present medical history and the treatment plan. Now, we have the past medical history as diabetes mellitus and osteoarthritis, for which she is taking metformin and Voltaren respectively. And she visits her GP regularly, and she's very compliant with her diet, exercise, and medication regimen. Her blood glucose level and urine sticks are assessed every week. Now the recent medical history, when we have got an idea that she has got diabetes and osteoarthritis, and she is on metformin and Voltaren. Now let's go ahead and see what exactly is the present problems. She has onset of tenderness, swelling, and pain in the right lower leg. So it became pain, swelling, itchy, burning sensation. You have noticed ulcers on the right leg with exudates and rigors since last night. So we have an abnormal respiratory rate and an elevated BP. Refer to Dr. Dean Mills, department head of the geriatric. So our department head is Dr. Dean Mills. So came for urgent assessment. And the diagnosis was confirmed that was cellulitis. The next day we started penicillin intravenously. Tablet paracetamol for rigors and fever, Panadol for pain, and injection laxatives to remove the edema and fluid retention. We have the rigors and swelling stabilized, itchiness decreased, limited burning sensation. We have improvement there. We have cleaned ulcer. We have dressed it. The next day we have swollen puffy face, redness of the eyes. Wound was red, less itchy. So again, because of redness of eyes, swollen puffy face, we have seen some side effects of the medications, and we suspect whether she's allergic to penicillin. And based on this suspicion, we have changed her medication. That's antibiotic penicillin is changed to antibiotic Ciplax. That's it. Now, The next day, redness has reduced, swollen and puffiness has reduced. The fluid was drained from the ulcer. Now injection. So she had made visible progress here. So the tablet is started right now in place of injection Ciplax. Paracetamol is continuing. Now the next day again, we have better prognosis. 25th, dressing done, weight slightly increased, so blood sugar level increased but controlled. And now she is about to discharge. She is fit for discharge tomorrow. Today is 25. She's discharged. She's getting discharged on 26th of November 2021. Now let's look at the discharge plan. Continue all medications as prescribed. So all the prescribed medication should go ahead. So medication compliance is something which we need to intimate to the nurse practice nurse. Need to monitor for any side effects of any medication. We need to monitor for any complications at the cellulitis side. And if there is any complication, you need to report to the local GP. The dressing should be done regularly by the practice nurse. And something is include referral letter from Dr. Mills, department head, geriatric assessment rehabilitation unit to her local GP. So her local GP is to be intimated, so with a referral letter, doctor. So it's out of this area, so we are not going to do that. We have the addressee, that is the practice nurse, has nothing to do with that, so we are not going to write it. And we have something very important there, that is a review after 5 days in the OPD. That's it. Now today's date is 25 November 2021. The practice nurse, I need to make this capital. Newtown Medical Center, dear nurse. Reference Miss Agnes Mabel, age 79 years. Writing to refer Miss Agnes Mabel, who has been under our care for the treatment of cellulitis. She requires further assistance and follow-up care at your facility following her discharge tomorrow. So she is discharged tomorrow. She requires your further assessment and following care at your facility. Now she has been under our care for the treatment of cellulitis. Yes, that's it. Miss Mabel, who has had diabetes since 2015, was admitted with ulcers on right lower leg with exudate. So here we have a bit confusion where she was admitted. She is at the geriatric assessment and rehabilitation unit. Mabel is admitted in the ward where you are a charge nurse. So she is admitted in the unit itself, I mean in the ward. You are a registered nurse at the geriatric assessment and rehabilitation unit. So she is admitted to the ward. So was admitted with, so where she is admitted, the location is not mentioned because there is a confusion here. Where she is admitted, she's in the assessment unit. So right now you are a charge nurse in the what do you say, the rehabilitation unit, the ward. So just we say she was admitted, we are not going to say where she got admitted. We just need to say where she was admitted with the ulcers on right lower leg. Okay. So we have two widths there. Miss Mabel, who has had diabetes since 2015, was admitted with ulcers and exudate on her right lower leg. So now we have got the correct construction. Was admitted with ulcers and exudate on her right lower leg. She also experienced pain, swelling, and burning sensation on both legs. That was the condition when she was admitted. In addition to oral paracetamol and Panadol, she was prescribed with intravenous penicillin and Lasix immediately after confirming her diagnosis. So immediately after confirming her diagnosis, that is cellulitis, she was prescribed with intravenous penicillin and Lasix immediately, in addition to oral paracetamol and Panadol. So oral paracetamol, Panadol, intravenous penicillin, and Lasix was started after confirming her diagnosis. Let's go and see. Yes. Started penicillin, tablet paracetamol, tablet Panadol, injection Lasix. So we have written all these things there. In addition to oral paracetamol and Panadol. So plus oral paracetamol and Panadol, IV Lasix, IV penicillin. She was prescribed with immediately after confirming her diagnosis. This was the first paragraph. Treatment schedule 1 is over. On subsequent days, she developed allergic reaction, probably due to penicillin reaction. And therefore it was substituted with injection Ciplax. Ciplax, right? I think it is Ciplax. Yes, it is Ciplax. So on subsequent days, we started insulin, penicillin, Lasix, Panadol, paracetamol for treating her cellulitis. But on subsequent days, we started the treatment, initiated the treatment, we have changed. We have made a change in the schedule because of allergic reaction which she developed. Redness of eyes, puffy and swollen faces. So therefore it was substituted with injection Ciplax. During hospitalization, her ulcer was cleaned and dressed regularly. Since she responded to the treatment positively, she has been switched to oral Ciplax along with other medications. Now, we have to mention, we have some past medical history, that is osteoarthritis, and she's on medication Voltaren. So it's not included here, but the diabetic history is mentioned there, which is relevant. Diabetic since 2015 is there in the first paragraph. So that thing is relevant. So it's included. Osteoarthritis. It's in, I think it's in 2018 there. Yes, 2018. And these are all Taryn. So here, just we go with the regular medications. When she has been taking medications for diabetes too. She's been taking medications for osteoarthritis too. So right now in this particular condition, this particular case, not we don't deal with that. We are asked to mention, we need to mention on the present medical history and plan. So a separate paragraph for mentioning the diabetics when she had diabetic and when the osteoarthritis. We don't have any other relevant past medical history here in this case. Not. We are not going to deal with her profession, her family, children. We do have a diet, medication, exercise regime, blood glucose level. We don't need to include all these things. We just need one relevant data here, and that is diabetes mellitus. And she's taking medications for that. So it is understood that if she is having diabetes mellitus, she should have medication. So it is clearly understood there. That is the rationale behind the non-inclusion of osteoarthritis and Voltaren there in this. Or else we need to start, we need to give a separate paragraph for osteoarthritis and Voltaren, and we have to say something about diabetes mellitus at when she had diabetes mellitus. As far as the question is focusing on the present medical history and the plan, the focus. So we are not going to say something in detail about this thing. Now, it would be appreciated if you could monitor Ms. Mabel's medication compliance and for any side effects. Kindly perform own dressing regularly and report to the local general practitioner in case of any complications. That's it. Please note she has a review at our OPD after 5 days. So that's also there. Now we have almost finished our letter. Now I can go with the full form there. Because I do have a we do have enough word space, so we can go ahead with the full form there. No problem. If you have any further queries regarding Mabel's condition, please do not hesitate to contact me. So we have one particular thing here, that's include referral letter from Dr. Dean Mills, Department Health Geriatric Assessment and Rehabilitation Unit, to her local family GP. So this is something which is not dealing with the practice nurse at the Newtown Medical Center. So that's why, that's the reason why we have not included that thing. So referral letter from our department health, that is Dr. Jean Mills, to her local GP. So we have the writer has no means to convey with the person whom we are writing to is a practice nurse. She has no role in that, so that's why we are not mentioning that thing in the discharge plan. And almost the things are there, almost all the things are there. Just have a look. We have organized into 3 paragraphs, 2 paragraphs, the present medical history, and another paragraph is the plan, which she has to, we have to intimate to her practice nurse at Newtown. So that's the end of the explanation. Thank you.